I want to introduce Dr. Clarissa Diamantidis from Duke Nephrology. She's a kidney doctor at Duke, and she's going to tell us what we need to know tonight about hypertension.
Well, great. Thank you for having me. I appreciate you guys joining us tonight. As Dr. Viola said, I'm a kidney doctor, and part of what I do is also treat blood pressure. And so there's a big relationship between blood pressure and kidney health. I'm not sure how much everyone knows really about what blood pressure is and what causes high blood pressure, but I'll just give some background, and apologies if this is sort of redundant from what you guys already know. But blood pressure is really the pressure of the blood pushing against your blood vessels. And so the blood vessels in your body carry blood from your heart to other parts of your body. And normally your blood pressure rises and it falls throughout the day. But if it stays high for a long time, it can actually cause problems, and it can cause problems to your heart and cause other health problems to other organs, such as the kidney, which I'll talk about in just a sec. And so, hypertension, which is a word that we use, is also called high blood pressure, which is blood pressure that sort of stays higher than normal. And in the United States, actually, uncontrolled high blood pressure is the second leading cause of kidney failure. And it can, when your blood pressure is high, it can harm your kidney function in a very short period of time. And sometimes even mild forms of high blood pressure can damage kidneys if it kind of happens over several years. And, in our country, in our sort of industrialized country, about half of all adults have high blood pressure. And only about 1 in every 4 people who have high blood pressure actually have their condition under some type of control. So a lot of uncontrolled high blood pressure. And so you may ask, well, what is uncontrolled high blood pressure? What's a normal blood pressure, right? And so generally we say if your blood pressure is above 130, which is the top number, which we call the systolic number, over 80, which is the lower number, which we call the diastolic number, then that qualifies as having high blood pressure. And then we have sort of different severities of how bad high blood pressure is. For example, stage 2 hypertension or high blood pressure is if your blood pressure is above 140 over 90. But, the question is, what does that have to do with your kidneys, which is sort of, what I do day in and day out is I treat blood pressure and I treat kidney health, and those two are sort of related. And so just as we said, when your blood pressure pushes against your blood vessels and can cause damage if there's a lot of pressure in those vessels for a long time, the same thing can happen to the vessels in your kidneys. And what that does is then it can damage those blood vessels, and it can sort of lower the amount of blood that goes to your kidneys and stop your kidneys from working well. And then when that happens, the kidney's not able to do their normal function, which is really to remove waste, sort of toxins and waste. And the kidneys also help get rid of extra fluid that you might hold on to. And what's troublesome about high blood pressure and kidney disease is that having the weakness in your kidneys where you can't get rid, for example, of this extra fluid can also cause your blood pressure to go up. So it's sort of like this vicious cycle, right? Which can lead to more kidney trouble. And in the US, about 1 in every 7 adults has chronic kidney disease, or about 37 million folks, and about 1 of every 3, or 33%, as we say, are at risk of kidney trouble actually in their lifetime. The 2 major causes of kidney trouble, as I've already said, is hypertension, which is actually number 2, and the number 1 cause is diabetes. And those 2 often go hand in hand, with a lot of individuals who have diabetes also having high blood pressure, and vice versa, obviously. And so, of those who have high blood pressure, about 1 in every 5, about 20% of those likely also has kidney trouble. And the problem is that just like high blood pressure, and just like high blood pressure, there's not a lot of symptoms of kidney disease. And so, many people have high blood pressure that's discovered when they just go to the doctor and they take their blood pressure and they say, oh, your pressure's up. And you say, well, I feel fine. I don't understand. And that's also the case with kidney disease. It's the same thing. And kidney disease is detected with 2 tests. It's detected with a blood test and a urine test. And that's sort of how we check your kidney health. And so if you have a high blood pressure, you should be checked for kidney trouble. Also, in the US, Blacks make up about 13% of the US population, but they make up about 35% of people who have kidney failure in the US. So ethnic and racial minorities are disproportionately affected by kidney disease and kidney failure. And the reasons for this, there's lots of reasons for this, many of which have nothing to do with biology, frankly. There's a lot of non-medical reasons. There's increased rates of high blood pressure in communities of color. Where people live and work, the food that they eat, how much exercise they do, whether they can get the medical care they need and deserve. All of these things affect your overall health, your risk for high blood pressure, and ultimately your risk of kidney disease. And so, there are things you can do certainly to reduce your risk of kidney disease. And the mainstay of that is if you have sugar diabetes, work to get that under control. And if you have high blood pressure, work to get your blood pressure under control. And so, following a healthy diet, which I'm sure you guys have heard from many people, taking medicine for high blood pressure, if you do have high blood pressure, may prevent kidney disease. It may prevent it from getting worse. And frankly, it may prevent other health problems like heart disease, which is very common also if you have kidney disease. I'll stop there.
And thank you, Dr. Diamantidis, for your time. And we'll wish you all a healthy dinner and a lovely night.